You heard of a CA11? Let me read you the title. When Injured at Work Information Guide for Federal Employees. That's it. So I've made these up specifically for this meeting, so you guys can have them. I'm leaving them with your presidents. You have more of them if you need them. My job is to help you get well. My job is to help your members, your brothers and sisters in arms, to not suffer when they hurt themselves on the job. Now, truth be known, in my practice, I do more than work injuries. I take care of everything. So I'm also a physician like any other doctor taking care of mostly musculoskeletal injuries. I do a lot of pain management. My background, I've been in practice almost 40 years. Yes, I said 40 years. I know the gray gives it away. I grew up in Miami. Anybody else from Miami? Okay, I grew up in South Miami, South Miami Elementary, South Miami Post Office, know it well. Came back to Miami after Los Angeles College of Chiropractic to get my degree in chiropractic, got my certification in acupuncture. I have a medical doctor who works with me. So we are really geared to musculoskeletal injury. So please, if you hurt yourself on the job and it entails blood, go to the emergency department. Go to the hospital. Don't come to me. Blood is at the hospital. You have an injury like a sprained ankle, like a pulled muscle, like a back, like a sciatica. And you know the difference between the CA1 and the CA2, right? Who knows the difference? CA1 is for a traumatic injury. You slip and fall, you go ouch on the job, you come to the steward, you fill out a CA1 with the supervisor, and what other form? CA17, 17, 16 also, but the 17, from our point of view, the 17 tells us your job description, what you can do, and then what we need to restrict you from so you heal. The 16 pages, but you know, I don't deal with the paying of you, so the 16 doesn't pay. Well, it authorizes me, yes. Yes, true. But I do that online through ecom. I don't do the 16. My ecom does that for me. 7 gets you paid, right? That's yes. The CA2. Repetitive injury, chronic injury, something that's been going on and festering and re-injuring and re-injuring. How many have a sore foot from walking too far? All right, well, you know, that's CA2 stuff. Now, I'm not trying to build cases here. That's not what I want to do. But when your member, your brother or sister comes to you with an injury, find out what happens so you know which form to give them. Also, who's the right doctor to go to? Do you go to your PCP when you hurt yourself on the job? No, they're going to give you the state work comp form. They're going to want the adjuster to call them. OWCP doesn't do that. You need to go to a credentialed DOL facility. Some urgent cares and some hospitals are credentialed, but they give you a hard time sometimes. Our facility is near Dadeland. I also am affiliated with clinics in Hollywood and Margate. So we have people around who can help you with, and I know in the newsletter there's one in downtown Miami. In your newsletter, there's one advertising there too. So we can make sure you're taken care of the right way, and that's important. Obviously, report to the supervisor. How many of you are finding that supervisors are a bit adversarial, a little bit against these workers? Find that a problem? Yeah, we too. We hear it from our point of view. Just spoke with a few people about it. There's nothing we can do. You got to just keep fighting the good fight, let people know. You all know who the union rep is for OWCP in the region up in Broward, Joanne Wright. You know, she's very good. She's very helpful for it. We've spoken to her a lot. We also deal with, you know, non-work comp things. So your Federal Blue Cross covers us for anything like that. A couple of things. You guys have unique injuries, unique problems. Lifting those heavy flats, putting them up. The walking that you do, getting in and out of the truck. I understand those things. The doctors and the therapists we have understand what goes on for you, and we're going to make a difference. I had one patient it was from the Department of Prisons, Bureau of Prisons, electrician hurt his back doing something, but he was a little overweight. He started with us. 8 weeks later, he got so motivated in the work we're doing. He lost 20 pounds. He got stronger. He went back on the job stronger than when he got hurt, which is exactly what DLL wants. You have to understand that we are obligated to help you get stronger than you were before your injury. Not just a pre-injury condition, but rehabilitate it so you don't do it again. Repetitive injuries get chronic, and that's a bigger problem. So I did speak with an expert on DOL before coming tonight, and I asked her, one tip would you give as our billing person who's been doing DOL OWCP for many years? And she said, I believe the most helpful thing would be to share and reinforce with them how important it is to keep a file of all their correspondence with and from DOL, starting with the CA1 or CA2, all the way to everything. You know how often we hear, I don't know my claim number, I don't have any of the paperwork, I don't have it. And you can ask Brittany, she makes a copy of almost every paperwork that's generated in our office for the patient before they leave, because we know how important it is. We're here to serve you. So the best part of a meeting like this is answer questions. Are there any questions that you might have about what it is, workers' comp, injuries, how to prevent injuries? I didn't come here to do a injury.
For the injured employee is to initiate a grievance or to pursue the injury on his own. And that's the thing that frustrated a lot of carriers when management can convert a claim so you don't get OWCP or seek medical attention immediately. What happens then? I know my officers, my issue is not with the officers. I'm making you aware that this happens. And it happens quite often.
So there's nothing that we can do other than, which is one of the things we do, a complete examination when the patient comes in. Establish that there was a cause of the injury and what the injury is. So our medical doctor and myself, we write the reports, and so far, DOL has loved them. And we've gotten, the first 3 claims we had were unapproved claims, were claims that were rejected, that we got reversed. Because our doctor was able to write the report in a way that really identifies that it's not fraudulent. This is true stuff, but he's really documented the detail. And that's the key. And once it's controverted, once it goes past medical, nothing I can do. I'm not management, I'm not you guys, I'm just a provider.
Okay, I understand.
Yeah.
So the bottom line is when he is injured and it is controverted, he should still seek medical attention and then look for the right doctor to heal.
Look for the right doctor to document the situation. And really, from the beginning, the minute someone is hurt, or the few days, they need to get to a good doc who can do the documentation. There's no cause for controversy if there is a good documentation of the injury.
Thank you for your knowledge and the answers.
Pleasure. Thank you for service to your organization. I've been a sergeant of arms. I know what a tough job that is. Sir.
Rick Miller, North Miami Beach. I have a carrier that's out now. He had medical problems. And my question is, does management supply the CA-17 to have him come back to work to show the limitations that he has?
So the CA-17 shows what his job description is. The doctor on the right side of the CA-17 puts in what restrictions the doctor thinks he needs to have to help the healing. So if you're an 8-hour walker, and we know that you can only walk 2 hours at a time, the restriction would be 2 hours, hour break, 2 hours, hour break, or something. So the CA-17 helps us determine what your job description is, so we can determine what limitations to be put on that job.
Can I request the CA-17 to get to the carrier to take to his physician, or?
Well, how long
does
does
it
it
have to go through work?
well, now it might be a CA-2 needs to be filled out for him to indicate this is an ongoing condition. The CA-2 is what enters him into the system. The CA-17 has to come along for the doctor to be able to make restrictions to his duties.
Okay.
So it needs to be revisited. I don't know how long it's been since he first saw the dog, since he stopped. You know, that there's issues there, but you know, we can see and see what we can do. I will tell all of you, my office, the one near Dadeland, I won't take patients north of the Broward line because I don't want you driving 2 hours to get to me in traffic, and it's detrimental. I had a lady from Bargate with a bad disc shooting pain down her leg. I'd love to take care of her. I could do a lot of good for her, but the 2-hour drive is going to be worse than anything else. So I can't, in good faith, take care of somebody that's going to get hurt driving back and forth to see me. I just can't do that. Any other questions? Any questions for Brittany, our documentation expert? Oh, someone's brave. He's coming up to the microphone.
Bob Guerin, Surfside. You said you have an office in Hollywood?
The doctor I work with has an office in Hollywood that is a credentialed DOL facility.
So,
You see me first, and then I arrange for you to go there.
Okay, so
Yeah.
you first went.
Yeah.
Gotcha.
Now, it's coming once to me for the consultation, the examination gets started, All right, then we determine what the issue is. I mean, if you had an elbow problem, I'd say, yeah, you can drive to me. Come, I'll take care of you. But I'd rather not get someone doing that kind of drive. Anything else? Well, thank you for your time. The brochures are in back. Any questions, you know how to reach me. Also, where are you, Mike? Mike knows how to reach me.